I'm Sylvie. I'm a lecturer with the NIHR ARC North Thames Academy, and I'm joined by some of my colleagues. I'd also like to just introduce Brittany, who will be handling the Q&A portion of today's seminar. So I think she just gave a wave there. Hopefully you saw her.
Hi.
Hi. The presentation is going to be about 40 minutes long with 15 minutes for Q&A. So I'm going to stop sharing now and introduce you to Luke. So we're really delighted to have Luke here and giving us this presentation on a really important topic, which I think is relevant for researchers, but also people working in different health and care settings, and trying to understand a little bit more beyond the kind of formal end of your project where you can see impact in your research. So Luke is the Impact Engagement Officer for the School of Medicine and Dentistry at Queen Mary University of London. He's the comms lead within the team and has worked across the university's other two faculties in his position. Luke has a background in scientific publishing with an MSc in Science Communication from Imperial and Biological Sciences at the University of Bristol. And I will very happily hand over to Luke now. Thank you so much for being here.
No worries, Sylvie, and thanks so much for a really nice introduction. So yeah, as Sylvie says, I'm here to talk about research impact today, and that's specifically what it is, but also once you know what it is, how to plan and manage it within your research career and cycles. Okay, and also if you have any questions after this, that's our general email impact address at Queen Mary. Okay, so just generally very quickly in terms of what we'll be talking about today. So as I say, we'll start off with what is impact and how is it defined. We'll then be going into why is that important to you as a researcher or within the research field. We'll then be talking about the types of impact you can potentially have. We'll then be discussing the impact journey and any relationship building that comes with that. Then into the planning and writing of your impact. And then impact support in terms of how you can get support within your university and beyond. And then finally, as discussed, a Q&A session between myself and you guys. So first things first, we'll be using a thing called menti.com today. So it's very simple, very easy, doesn't need anything to sign up or anything like that. Basically just add a little bit of interaction for this webinar. So all you need to do is go on to menti.com and then use that code at the top, enter that code, and that question will just pop up for you. And all you need to do is answer it, basically. So obviously I'll give you a little bit of time on that in terms of just logging on to menti.com. But basically I thought to get things started, I'd ask, how is impact discussed within your institute or your organization from your firm? Because I know there are some people here aren't necessarily from universities, but also from partner organizations as well. So that ranging from, it's not really discussed at all, to it's only for certain member staff, and senior, to is it for established PIs, you have to be quite established to be a part of it, or it's something that's seen for everyone and anyone can get involved. So yeah, I'll give you a few seconds because obviously you need to get onto the menti.com, but it'd be great if we get as much participants as we can. Okay, yeah, I mean that's good healthy chunk of people saying for everyone, which is great to see, and not many people saying not at all, which is even better. But yeah, it's always great to see what the kind of impact culture is within different institutes and different organizations, and whether or not it's seen as something, even if it's discussed widely, whether or not it's discussed with you guys in mind as well. So cool, I'm going to move on to the next slide, which is also another Menti question. So what do you know about impact is the next question. So would you describe yourself as an expert? Maybe not, since you're here, but would you say you can get by, or you've heard of it, or you don't actually know what it is, and you're coming here to try and really get a grasp of what impact could or could not be for you? And there's no wrong answer, by the way, just to be clear. Okay, so far there's a strong amount of people in the middle, which is probably the perfect amount, to be honest, or perfect spot for people, because it shows that, you know, if you're an expert, maybe you don't need to be attending, and two, if you don't know what it is, that's obviously not a great sign in terms of, like, you would hope within institute somewhere you would have heard about it in some capacity. So I get by and I've heard of it is great to see, because that means hopefully by the end of today, you can push yourself up to maybe an I get by, and who knows, maybe an expert. Cool. I'm going to be moving on to the next slide now. So the next question is, and the most important thing before we get started on any of this is, what is impact? So impact is defined as a contribution, effect, or benefit that excellent research can have on the following. Obviously, I've highlighted it at the top there because that's most relevant for you guys, but I'm also, as I go through this presentation, will try and reiterate that, health is something that intertwines with these other themes as well. And it's not something to necessarily forget about or turn a blind eye on. So first and foremost, health and welfare, or the NHS. So that can come in the form of clinical guidelines and patient benefits. You can also get impact within culture and society. So seeing public understanding and social enrichment. You can also have economic and commercial impact as well. So a commercialization of a medical device potentially, or NHS investment. Policy, that is broad ranging across all of academia really. And it's something that's definitely becoming more and more noticed and to the fore when it comes to researchers. So seeing changes and updates within policy as well. Environmental effects, of course, can have detrimental effects within a medical sphere as well. So it is something that goes hand in hand also with health. So looking into protection initiatives there. And also services, so how organizations are run and the practices they work on. Are they effective? Are they not? Are they out of date? Do they need changing? Working with the beneficiary in that regard to try and create a new form of impact. So the key things here, one, it needs to be on a bedrock of excellent research for you to end up getting that impact in the first place. And two, it's beyond academia. So there is such thing as academic impact, but it's not really something I'll be discussing today. And the key thing here, it needs to be outside of the sphere of academia. And how does it benefit society as a whole? So going further into it, into what is impact. So it does need to be specific to each project. So some people get a little bit hung up about maybe they've gone down an academic silo where they don't see how they could get out of it in terms of interacting with other people. But I always try and recommend, I would try and encourage anyone who's in research that, if anything, the more specific, the better, because you're really honing in on a particular project that should be unique to you. And therefore, as a result, the impact will be unique to you. So don't ever worry, I won't know if my impact will get to something in particular or not. Which then leads into my point of that it could be the impact, despite how specific your project is, the impact that can come from it can be wide ranging and varied, and can come in all shapes and sizes. We have multiple forms of Queen Mary, where, some of the impact you get from the research you wouldn't even think that would potentially occur. So we have a dentist or a dentist school. Within a dentist school, we have a team which works particularly within X-rays of 3D scanning of teeth. And just by being at particular conferences when it comes to these touch and technology, they ended up in communications with people from the arts and humanities, who then ended up working with them to help restore historical artifacts, which using that 3D reconstruction. Again, not necessarily where you would want to go, but just as a flavor and example of, there is, whatever your research is, impact can come from it, and it can come in all shapes and sizes. It's also worth noting that impact come in a direct form. So from one piece of research, one researcher, maybe more in the social sciences and healthcare in the healthcare situation, but also it can come in an indirect form from a large body of work. So that's another thing I try and reiterate as well. So with academics or researchers that are working in giant pools of work, so working within consortia in cancer or genomics, you can sometimes think, oh well, I'm just a drop in the ocean here. Obviously you're doing good work, but can I pinpoint this as something that I can directly say, well, impact's coming from me? And I think it's always good to note that this is something that funding bodies and other and senior staff within your universities will understand, that every form of impact is different, and they are significant in different forms of way. And obviously the work being done there in those areas need to have that many people. So it makes complete sense, and therefore don't worry about it. So what is an impact? So I've got a little list here. So patents, media interest, public engagement activities, collaborations, presentations at either meetings or events, or just general dissemination. See, all these things are great when it comes to impact. It shows that good work is being done, but it's not necessarily impact. They're impact activities. And the reason they're not impact is coming up to the line at the bottom there, which may be one of the most important things if you take away today, if you're not sure about impact, to think about, is that impact from the above is basically equates to demonstrable changes in the following. And I think demonstrable changes is the key term when it comes to impact. It's something changing for the better within society that you can, demonstrate and prove and evidence. Because it's all very well saying, oh, this has changed this person, this has changed these lives. If you don't have a way of evidencing that, then can't necessarily claim that impact to be yours. Or even, if no one else is saying it, then if that impact actually exists. So it can kind of come in two kind of forms. I kind of see it as demonstrable changes in people. So in terms of like their interests, their understanding, their behaviors after which the work you've done, or on a more larger organizational sense in terms of the changes in processes, policies, priorities, and recommendations. So why is impact important? So first and foremost, not to beat around the bush, research funding. So most funding bodies these days have an impact section in their grant applications, and you will be asked to revise what you're working on if you haven't properly looked into it and worked on research and worked on how the impact will properly be realized in that grant application. And they'll ask, it's a significant part of applications these days. UKRI doesn't have a specific pathways to impact section anymore, but that is because they specifically now and see it as a cultural change has already happened within the academics world, where they see you to embed impact throughout the entirety of the application, rather than just having a specific section for it. REF, so that's the national benchmarking exercise in which the country assesses the quality of research within universities. They have 25% of that score is down to impact case studies, which each university or institution has to submit. And to show the significance of impact, it's a 7-year cycle, so 2014 was the one before 2021. That was 20% of the scores in impact case studies. This time around, it's an extra 5%. So showing just how big on the agenda it is for the country. I know not everyone's going to be here from Queen Mary, but from our perspective, we have within our 2030 strategy, we specifically include impact in that to reflect our global ambitions for the coming years. So yeah, UKRI at the bottom there, they state how they exist to fund researchers who generate the knowledge that society needs. So in other words, researchers and research. But they also state that, and the innovators who can turn this knowledge into public benefit, and that, AKA, is impact. So it's something high on the agenda for a lot of people. But why should you guys care? Specifically, obviously, these are big grand schemes, and one of that in that pie chart there, funding bodies, is still something you can't turn a blind eye on. But there's other reasons as well outside of that are not just the bureaucratic reasons necessarily. So you can gain a lot of different types of skills. So you may be someone who's very much been in the lab and worked specifically in a very specific environment. If that is the case, if you're looking to try and influence policymakers and try and put something forward to a select committee and see how things can try and change policy and governmental processes, that's something that is very, very different, and therefore requires communication skills, negotiation skills, an ability to present an argument, which you wouldn't necessarily be doing in your day-to-day. Likewise, I always say with impact, it's something that you would be, deep down, is something you would want to be doing anyway. It's people go into academia or research, whether or not you're one of the partners here, whether you're an academic or whatever community you're representing here, people go into research primarily because they do want to have impact. It's just this is a formalized way of looking at it. They go into it because they want to see change and they want to see good come of the research they're working on. And this is something, a way in which you can try and hone that and try and get in on the ground and see what people actually want from my research and how can I help potentially. So it's getting that different way of thinking. But But likewise, it can be a bit of fun. It's not, it is still work, but it's as I say, a different way of thinking, communicating, and it can change things up aside from you just being very lab focused or in hospitals all the time. So next slide. So types of impact. So obviously I've circled there health and well-being as more the primary type we're going to talk about today. But I've also included the others as well, because I still think that there's a lot of interrelation. And I can't speak for all institutions and organizations here, but something in the new year for Queen Mary, for sure, we've been very much looking more towards interdisciplinary and multi-themed research projects these days. And it becomes more and more relevant knowing these different areas in which you can intersect potentially across research. So we've got health and well-being there. So patient benefits are an obvious one. Clinical guidelines is another way in which you can see impact. Clinical practice changes. So, if there's new pathways to treatment, new pathways to new types of drugs. Likewise, seeing investments from the NHS is a big sign of type of impact as well in an economic sense. And likewise, having benefits to both families and clinicians as well. It's not, you sometimes forget that is also something that can be of substantial impact. Of course, patient benefit will always come first, but within the sphere of health, there's those sides to think about as well. And I'll just quickly rattle through the others as well. So cultural society, here we've got public interest or debate is type of impact. You can have their social welfare, cultural enrichment. From an economic and commercial side, again, if you think you created a medical device, commercializing that, attracting investment, potentially even a spin-out company, who knows. Public policy, providing evidence-based policy making, and maybe even influencing the work of an NGO or charity, lobbying with them, making a campaign with them in order to see that policy change to begin with, and getting campaign reach from that. Same goes for environmental changes. So you can look in terms of ways in which can be more sustainable in terms of how you are operating within your research, but also in terms of how you could work together with charities similarly in public policy in order to lobby for change for environmental needs that could be beneficial to the patients. And then likewise, and then finally with practitioners and services, new methods of models of change and change of management practices, even potentially within hospitals, new services, new processes. That one always intertwines with all types of faculties, really, that the services one. And again, something to always keep an eye on. So the impact journey. So you've got to start somewhere, of course, when it comes to impact. And you've got to kind of have a rough end goal. You want to be, generally speaking, you want to kind of know where you want to end up. But the key to impact is, what are the steps to getting to there? So you have to think about your impact journey and the impact activities that will come along the way that you will enact over that time to try and ensure the impact will come about. You can't ever promise that impact will happen. Like, there's no guarantees in anything, but you can very well make sure you have as many things set up as well as you can to ensure that you can, best likelihood you can get that impact. And when it comes to trying to get funding, maybe even promotions, maybe when you're trying to look into show what kind of impact you're going to have, there's a clear, concise and strong impact plan alongside what you're trying to claim. There's a lot more likely you're going to get funded, because they'll be like, okay, this person's being realistic, but they're being ambitious at the same time. So first thing's in the impact journey. So you have to have that problem, or that interest that your expertise as a researcher can solve. And likewise, that can also involve PPIE as well in terms of patient-public involvement and engagement. I should also point out that you guys being within the ARC Academy, you have access to UCL partners, and they have a huge network there with regards to when it comes to patients and public involvement and engagement. And it's really something. I mean, again, the fact that this call is not just based off research at your classic academic researchers from institutions, and that there's partners here from medical organizations and charities and community groups as well, just goes to show that, and across the healthcare professionals, just shows that there is that wide network there. So it's something you guys should definitely tap into and use both their panels for assessing the readability and the feasibility, but also making sure that there is an impact, aka a benefit to society, public, patients that your research is having, and it's not siloed. So then leading on to activities. So, you're then going to have to undertake the research. Once you get funded, once people go, yep, let's do this, you've got to do the thing. So that's the activities, and you've got to produce those results. Next point is your outputs. So of course, you've got to use your publications, abstracts, patents, reports, blogs, etc. And then once that information is there, it's then, again, it's very much within an academic sphere still at that point. And what you need to do then is disseminate. You need to make sure that information needs to get to the right people in terms of then potentially generating impact. How you go about that, many different ways. And these are impact activities, as I say. So that's generating media interest by developing media contacts, potentially. Using public engagement is a very good way in which you can then interact with different community groups. Again, for Queen Mary, at least, we've got a very, very strong public engagement unit called Centre of Public Engagement. Obviously, this is going to be different for other people in this call, but have a look at your institutions, your organizations, and see if there's something there that can help you in that regard. Likewise, conferences, whether or not you're running them or attending them, they're a great way to disseminate your information. And finally, events. If you can put on an event tailor-made for the people that you think would be very strong stakeholders in your research and your impact, the more the better. So the meld of outputs and dissemination is what the roots to impact. So that's what the two combined will go about generating your impact, hopefully. Because then the impact, it all leads down to the usage of your research. So is that effect, change, benefit to the beneficiaries you had in mind? Doesn't have to be the people you had in mind, but is that benefit, is there beneficial change happening that you can demonstrate? So that's impact journey. So now that's the general thing you need to kind of be thinking about, but how, you still got to think about the nitty gritty of that. So how are you going to plan for those steps? So first and foremost, as I say, you've got to think about your research and think about the types of impact you can actually generate. So there's those broad themes that I've been talking about. So economic, cultural, health, policy, environmental. Of course, everyone here is going to be health, but I should also say, that doesn't mean that isn't going to be some intersect between some of the others. It could just be a pure out and out health impact, and that's totally fine, of course. But don't rule out the possibilities based on what your research. Always think what your research could tap into. So next up is who your beneficiaries are. So as I say, vast majority of the time, with patients or different types of patient groups. Knowing specifically what type of patient group is obviously important based on the research you're working on. But likewise, they're going to be what kind of stakeholders outside of the beneficiaries that you could potentially be working with or collaborating with. Are there industry partners you can work with to help generate a medical device that your research obviously has made good strides in making it available, but in terms of making that en masse, making it a commercially viable entity, you'll need an industry partner, you'll need business partners and business development teams. And you need to develop those relationships. If so, likewise, if you're looking to push something in a clinical guidelines and try and get those changed, you need to be on guideline committees. You need to be, or at least know someone who does. You need to have those conversations for it to scale up and maybe make it global. But you have to have those first ins and think about, if you don't, how are you going to acquire them? So that goes on to the when. So when will you engage these people? If it is patients that are and feeding into the PPIE, that is feeding into the research process, then is that something that needs to be happening at the very beginning, or if it's not in that, if they're not feeding into the research process, can it happen a little bit later? But you don't want to be leaving it too late to the point of like everything's ready to go. You need this one in for the policy change or for this product to be made, and it's no dice, and then you're hit an impasse. So that building those relationships as early as you can is the most beneficial thing you can do, really. So knowing when is crucial. Types of engagement. So, these people may be something you may have it easy in with, a small connection. Your supervisor or someone from a partner within ARC, or someone from a different institution maybe, or someone from your institution, maybe in your PI, who knows. But you have, basically, you want to know how best to engage with people. So that it could be very small, but for the most part, you want to be as strong as possible with that reach out. So can you put on events? Can you create websites to promote the activities you're doing? And is there any specific activities that you could do? As I say, could you work with a public engagement team that you have access to generate public engagement events and things like that? And as a result, that then leads into, well, what resources will you need? Because it's all very well having all these activities you think you can do to engage with stakeholders or to generate the impact. But if you don't have the resources, then you won't be able to do it. So, do you need a venue? Will you need catering? Will you need a poster? Will you need designer, either a web-focused one or physical designer to generate the posters, generate the style of the event? Will you need a social media campaign? And you need someone to manage that. How much resource, time-wise, team-wise, and money-wise will you need? Next up, evidence of impact. So how you evidence that? So you need to go back to my point originally, like impact change is the most important. Demonstrable change is the most important thing when it comes to impact. Of course, benefits, it needs to be a beneficial thing, of course, but showing the change is where impact lies. So, if you had a medical device, product sales, could you see policy change? And likewise, could you see patient benefits? Can you measure that? Which goes on to my next point, measure of success. Because seeing a change is impact, yes, but the quality and the significance of that change is all down to the nuances behind the measure of success. So is there positive feedback that can fall behind it? And is that feedback from someone very legitimate and experienced within the field? If it's, patient feedback or patient testimonials, you need a big sample size of that to represent the population as a whole. Likewise, if you had a social media campaign, as I say, who's running that and who's doing the metrics and work on that to show Twitter followers, Twitter engagement, positive, negative, have people had a sustained change. So can you tap back into that to see that change remains rather than just someone thinks something for a bit and then it leaves them momentarily afterwards. So leading on from that, I'm going to talk very briefly about examples of impact activities. So we've spoken a little bit about what impacts can look like, how it's the journey to get to that endpoint, the different types of things you need to think about in terms of activities in the build up to it. But give me some specific examples here. So things that you could do that could potentially lead to impact. So when it comes to policy, writing a policy brief, giving evidence to a select committee, campaigning with a relevant charity. Comes to services, co-production of research and impact with the beneficiary, cost effectiveness analysis for a new process, and assessing acceptability of a new process. When it comes to health and welfare, research days for patients is a very good way in potentially resulting in some impact or getting those early doors in. Sitting on guideline committees and potentially trying to influence them. And then likewise, writing advisory documents for patients and their families. As I say, of course, patients are the key, but there can be impact in terms of families, clinicians, the other things that surround health. Impact activities in the other areas that I discussed, so cultural activities, public engagement activities, as I say, exhibitions, performances. From an economic and commercial standpoint, spin-out companies, licensing a medical product, device or a product or a service to a company, doing a cost-effectiveness analysis as well. For environmental, campaigning is quite a big thing when it comes to health and seeing those changes that can then potentially have a knock-on effect. We in our university, we have some researchers that work very high on air pollution within London, not just London, but specifically, obviously, we're in the East End. So, but and the effect that air pollution can have on patients and the public as a whole, and how that is a long process. But working with different charities, giving evidence to relevant select committees, these are all ways in which you can build that and result in a potential impact, which we have seen within our university. And a cost effectiveness analysis of any new inventions. Okay, so we're not done, but that's the kind of the long and short of what impact is and isn't, and how the planning element to it. I'm going to talk more about how writing about impact in a second and different types of support, as I mentioned earlier. But if you guys could quickly go back into menti.com and see what do you now know about impact comparatively. So it goes back again, am I an expert? Not necessarily need to be an expert, but do you understand it now? Do you think you'll get by? And no shame if you still don't get it, that's totally fine. And it's my job to try and persuade you otherwise in the coming remainder of the session. But equally, I'll be sharing my email at the end. If you have any questions, I'll be more than happy to field them afterwards as well. But so far, looking good in terms of people's understanding, which is great to see. And someone said they're an expert now. So, you know, equally good. Okay, so we're talking about the impact plan, the impact journey, impact activities. So, you know, these are all components and, you know, in a way jargon, I suppose, but how do you go about writing that impact plan? These are actual things, ways, approaches you should go about writing, which you should, the do's and don'ts, basically, based on having seen a lot of people write about impact. There's some people that think they know what they're doing, but not necessarily. So it's always good to try and get a read on this if you can. So regards to do's, as I said at the very beginning, be project specific and don't generalize. You know, they want to see the uniqueness of your work, and they don't want to see some generic thing. That if they see something great and unique, that's a plus. So as tempting as it can be to just try and find something else that you know did well, or somehow found out was a good application for either a case study for ref or a UKRI bid, and you're just like, yeah, I'll just use that, try and implement the same thing. It can be seen from a mile off from people that are doing this day in, day out. So I would say it's very much worth your while getting familiarized and well versed in impact, and then implementing it into your research rather than the other way around, and trying to use someone else's work as a means. Don't oversell or overhype. So keep it modest, but clear, measurable, and achievable targets. And that's always preferred to something that just doesn't seem realistic. Again, being specific and realistic about the beneficiaries and scope of the impact you have. Again, they can read that, they can see it, and they will very much appreciate that. They want you to be ambitious, don't get me wrong, but they want you to have achievable targets. So, you know, if you don't have any contacts or stakeholders that could help you build in the particular area of impact, it's not going to be overnight that you'll be able to get the impact. You're going to have to develop those relationships, work out who you need to speak to potentially, and what kind of extra work you may need to do in order to get that. And that may be on even, like, you know, a local level or a regional level or a national level. Again, saying if you're going to do something that's going to change the global health world, maybe you will. But again, you've got to back it up with something that's achievable based on what the work you have. And as I say at the bottom there, indicate when in a project impacts will occur. So you don't have to necessarily be a chronological order. You can come in the big hitters first to try and, it's a narrative and it's an argument at the end of the day, but do keep your timelines understandable and reasonable for anyone who's reading it to get it, even if you are chopping and changing a little bit in terms of chronology. Writing impact don'ts. So don't cite journal publications or academic conferences as a method of achieving impact. As I said earlier, that's academic impact that a lot of, as all the places I've mentioned so far, don't consider that impact. It's its own separate entity, so avoid, I'd say. And as I previously mentioned in the last slide, don't cite relationships you don't have or can't plausibly develop. You know, it's all fine being ambitious about someone you could, but if that's just not possible, if it's some very high up within government you have no connection to, then it's not necessarily going to happen. And again, people will be able to clock that. So next steps. So basically there's support from impact staff, whether or not this is applicable across all the institutions or organizations that are attending today, I can't necessarily confirm, but I can tell you what we do in Queen Mary. And, you know, this is our first version of doing an impact session across the ARC Academy. And that's not to say we couldn't do something, maybe something different. That's not to say we can't develop something else in the future. So even though this is very specific, what I'm saying that this is something that could, one, be reflected in your organization already, and two, is not something that is not outside the realm of possibility to develop in the future. So first off, so Queen examples here in terms of advice, we give impact drop-in sessions. So we'll set aside a couple of hours where a handful of us within the team will be available, and you can book in a slot of half an hour with us, and we'll sit there, go through your application, go through your work or your research project, look where you need to improve, give you some tips, give you some pointers. If you have an actual application, we could potentially go through it beforehand as well. And as I say, that we could do one-to-one support for grant applications. So even if you don't have part of that official impact drop-in session per se, you can always we always allow our lines to be open to researchers who want to just drop us a line. We can go through the grant itself, or we can go through it over Teams, either or, whatever's easiest. We We also, impact staff give support in terms of, and I think this probably is applicable across institutions and organizations, is that, it helps relationships, building those relationships with external partners to evidence impact. You all know your partners and your stakeholders better than anyone. And we're at Impact, support is always there to try and facilitate that rather than to necessarily steer it. But at the same time, we do have experience in navigating that sometimes, and keeping on top of things may not be necessarily easy when you've got a million other things to do. So we can always help in that regard. And I think that's one thing, I guess, another key message for today is that when relationships are a really key thing when it comes to impact. And I think how you manage those is key as well. So you're always fearful of potentially badgering someone and constantly going, right, we get it, impact, sure. So there is an element of truth to that. If you keep going back to them, changing your mind about what you want, then that can be irritating. But if you very clear in what you want and don't really deviate as much, and you check in every once in a while, they can build a very good relationship there. Obviously, some people are different. Some people are more highly strung than others, but you learn and adapt. And that's the thing we at Queen Mary very much had tried to help support in the building of that. But the key point there is that a little check-in every once in a while in the build-up, because it takes a long time. It can take years to develop impact sometimes. Well, for most of the time, to be honest. So you need to make sure you're checking in to make sure things are ticking over, but also that you've got good relations where it comes to a point where you need to submit something somewhere. You can go, hey, can I get a testimonial? Can I get a letter of support? Or some sort of data or information that helps strengthen this argument, and someone being there to go, sure thing, compared to, what, I don't know, we haven't spoken in ages, this is going to take forever or whatever. So as I say, keeping on top of that is crucial. Something else we do in Queen Mary as well is we help try and raise the profile of impact, both internally and externally. So obviously using our websites, we do mini awards sometimes as well, and just showcases when we can to try and help embed that culture of impact and trying to help it more. Now the ref is over, thinking more generally speaking rather than necessarily centric to that. Future support from Queen Mary's impact team. So again, I'm speaking purely from my own side of things, just because this is who I represent. But we're in the ARC Academy, and this is something we can tap in, and the aim is to try and develop those relationships more if we can. So, I'm Luke Cridland, the Impact Officer at the Medical School at Queen Mary. Steph Taylor is Deputy Dean for Research Impact at the Medical School, and we're kind of the face of it within the Medical School at Queen Mary. So obviously there are people here from Queen Mary who are attending this session now, but I'm put our email there just in case anyone does want to get in contact at all. We're happy to chat. Likewise, other impact support to think about. So I've mentioned it earlier about business development, like any kind of business teams that you could potentially tap into in your organizations is great, especially if, as I say, medical working, commercializing the commercial side of medicine, it's not necessarily your first thought in the UK especially, but it is something that exists. And if you do have a medical device that is, something that could be commercialized, and is being commercialized, that you need to have the right conversation, the right people. You want to be talking to people who can help you with intellectual property, help you with spin-outs, helping with business stakeholders and partnerships. We have specific expertise in that regard. It's definitely worth reaching out to them to make sure that you get the best situation for yourself and the impact too. As I mentioned earlier, public engagement team can really help as well with regards to patient groups or communities. They're not necessarily, their remit is there for dialogue and mutual benefits of both people involved, both researcher and the group. Obviously, impact's slightly different from what I described today, so that's why we have to work quite closely with them to ensure both teams work, get what they would really like out of the relationships. And then there's events teams, design and branding teams, widening participation, PR. Within Queen Mary, have Centre of Cell, which works very closely with younger kids and teenagers with medical, trying to get them interested in medicine and biomedical sciences. So always think about all the different teams you could potentially tap into across your universities and your organizations and your trusts and etc., and how they can all work together to try and generate impacts, because you can't do it by yourself most of the time, and it does need a collective effort. And most people do, as I go back to it, most people want impact from their work. It's just whether or not it's a formalized thing or not. So you'd be surprised at the help and generosity people can give you in that. Cool. So that rounds me off. I think I'm literally 1 minute off, I think. But yeah, so that's research impact, planning and managing it. I'd say my name is Luke Cridland. I'm Queen Mary Impact Officer for the medical school. That's our general email address for the impact team, impact@qmr.ac.uk. So again, feel free to just drop us a line if you want, or you want to chat things about impact. Happy to help. But yeah, hopefully that was useful. And as I know, we've got the Q&A coming up now. So yeah, thanks guys.
All right, hi everyone. Thank you so much, Luke, for that fantastic presentation. We've had several questions come through, and any further questions, please post them in the chat. Some of them are in relation to further clarification on specific examples of impact. So one of the questions was, for example, if a particular initiative of research is to improve public engagement in health research, then this would be an impact, wouldn't it?
So as I say, public engagement have a slightly different way in which they look at their work. So it's a dialogue first and foremost, and also it's a mutual benefit. But it can be an impact, but it's not. So the thing when it comes to impact for us is that demonstrable side. So it's not necessarily, when it comes to public engagement, they're not necessarily thinking about, oh, where's all the evidence, checking in with all the patients, give us these documents, etc. And that's why it's a delicate relationship to try and develop, because you don't want to be that harassing person, especially when it comes to certain sensitive relationships. But yeah, that's why there's a slight difference, because public engagement can get impact for sure. But if you don't have any way to prove there's impact, then you can't necessarily deem it as impact. So that's the way you've got to kind of look at it, I think.
Great. I believe the next question is in relation to your slide on what is not impact. So it says that I interpreted that slide as saying just holding a public engagement event alone is an impact, but proving how many people came and the positive feedback they gave would be?
Yes. So to an extent. So I think it's something you should, another thing to think of is like there's layering to the significance of impact. So you've got like your base level. So just having the event, seeing whether or not anything's changed from that, if you're just having it, it's not necessarily going to be a change. So having attendees, that's great. There's a list that's significant in terms of you can say, right, these people attended. But then, that's the base level, because then you're like, well, what's actually changed for the benefit here? They could have come away with some great messages, but we're not actually sure. Then the next level on that is feedback. So whether it's positive or negative. So if it's positive feedback, of course, that's great as well. But then the final layer is, nuanced and detailed feedback. So if there's a way in which they can get feedback from them, it's like, yes, this specific thing that you did, this research, this public engagement, etc., has resulted in this. They're not going to necessarily phrase it in its exact words, but this impacted myself. That is the best kind of levels you want to see in terms of like a highly significant impact. Obviously, you can have impacts in different ways, but that when it comes to those sorts of things, it's great. And also, if there's any way in which you can tap into that again further down the line to show that's a sustained change rather than this is how they feel at the time, obviously that's even better. But that's easier said than done sometimes when you're hosting an event or something like that.
Excellent, thank you. Next question would be providing training to clinicians and/or increasing experience and research skills for service users be counted as impact?
Yes. Yeah. So it goes. So that's more like the practice and services area that I was talking about. So if you can. So you can have change within methods, and you can have change in terms of in which practice is run. And again, if it's a positive thing, you need to try to prove that this is a good thing for people. So again, you want to get, first and foremost, you'll be able just having those changes, structural changes within services and applications would be impact in of itself. But if you're getting feedback from both, the people, the employees that are working there, or the maybe even management as well, to see if like what their opinions are, whether there's a HR component as well, feedback from all those things, and then whether or not this is a new process in which you would want continuing going forward as well. So yes, it is impact, but yeah, you want to think about how, again, going back against that capturing of the evidence and how you're going to show that to people.
Excellent. Next question would be, should the work and outputs of impact be added to a Gantt chart in a funding proposal?
Yeah. I would say not it depends. Obviously, like this is a bit of a cop-out answer. It depends on the application. But I would say I would err on the side of no, because you want to try and give. Again, if they ask explicitly for it, definitely do it. But I would err on the side of the fact you're giving that argument across. So it's not necessarily. It's about what you're going to be providing as a researcher. Obviously, and again, it goes back to the realistic timeframes and stuff like that. But I wouldn't say it's necessarily what you have to do. But again, if it's something, different applications, different needs. But yeah, making sure your timelines are sensible is first and foremost. That definitely needs to be there. Whether it needs to be in a Gantt chart form, that's up for debate, I'd say.
Great. Next question is, could we not argue that there is always impact? Negative findings are as important as positive findings.
Yes, I would say, again, it goes back to the definitions, I guess, a little bit here. And you're trying to harmonize definitions of impact. So there's different definitions across the board, but I think when it comes from the UK academic sphere, the fact that REF and UKRI's definitions are pretty much aligned. That's kind of the way in which we look at it in terms of showing that there's not, there's having negative results. I think you can also, prevention of harm is also that's a positive in that, you're stopping something. So that's not a change necessarily that, you stop preventing people from doing something, but if that thing's harmful, again, going back to environmental changes, you may be putting potentially diesel cars out of work or something like that, like affecting their industry. But there's the grand scheme of things and the health related benefits that a negative then can turn into a positive. But yeah, I'd say you do kind of need to show something for it in terms of what the definitions are when it comes to applications for funding.
Great. And another question. So how do you deal with the issue of attribution of impact to your research? There is no counterfactual. Often policymakers in particular do not attribute to specific pieces of research, for example. In any case, there is rarely one research project that leads to impact. Needs some bulk and high quality, mostly important.
Yeah, I get what you mean in terms of with policy, there's, it is tricky. And I like, it's not a perfect system with regards to, if you're not going to get cited, being recited in a government report is a great way of evidencing impact, especially showing that you've specifically, this is now evidence change, and the way in which they approach policy is changed as a result of your work. So if they haven't cited you, then obviously that's not great. And it's having recourse on that is tricky. I totally get it. But I should also add, you can always try and find alternative methods in evidencing, albeit, it's a bit annoying if you're going to have to go off, like say, news articles comparatively to an official report. That may be a bit annoying, less official maybe in terms of evidencing your impact. But just to give an example, we were working in REF, obviously just recently, in terms of the evidence types you can submit, both are just as valid. Obviously, you've got one very big official report from the government that's very clearly saying this work has influenced this. That's going to look great. But if you've got to do a bit more digging to show, oh, well, actually, it wouldn't have been possible without me by doing deciphering news articles and going on the web and going on social media, then it is possible. And I'd also point out that with regards to applications, going back to one of my original points, was that, big bodies of work have to contribute together to have a change, and to say you've specifically yourself, you're the big I am in that scenario, is quite difficult to make that claim. But UKRI REF, they know that, like it's not news, and they take that into consideration when it comes to applications. So again, it's that transparency. So as long as and you're being clear and honest of where you were, your work you did, then you'd hope that on the other side it's going to be the same reaction.
Great, and I guess that leads into the last question that we have really, which is how do you deal with the fact that research findings of a single project are rarely sufficient to change behaviour, practice or policy? Yeah,
so I would say, again, it goes back to it's a group effort, and sometimes it can be a small team. It again depends on relationships. Sometimes you can have ridiculously good relationships within government that can just push you up. I know, unfortunately, and help you in that regard. But I would say, yeah, it's not something to be discouraged about, because it is something that's known. And also it's also known that like policy can sometimes take a really long time. Like, you know, you've got to have change within maybe a particular guidelines committee, for example, and then you can then assess more data and then have to present it on a bigger scale, maybe looking at NICE, or maybe going again into more government-based policy. They all take time. So, and again, that's something that's known. It's not news. So it's not a perfect system. I totally appreciate. But I think as long as everyone involved knows that and tries to be as fair as possible with that knowledge, then that's hopefully as best as we can do with it, I suppose.
Great, thank you so much, Luke. Just a last few things. So there's been some great links in the chat from Sylvie Cooper that are some useful toolkits from the NIHR. So I'd recommend taking a look at that. We've also had someone post in the chat from UCL Partners AHSN, working in the commercial and innovations team. So they've got a link for an email in there, and they said that they're always open to conversations regarding this.
Oh, excellent. Yeah, that's exactly the kind of stuff I was hoping. But yeah, that's good. Is Brittany frozen?
She might have, yeah.
Yeah.
Just for an opportune moment. Yeah, I also just wanted to highlight that Niran kindly noted that for ARC North Thames, herself and Jenny Shand are available to speak to any people who are within local health and care partnerships that can be connected between them. And she's included both hers and Jenny's emails in there. If you are kind of ready to disseminate your work and want to make sure that it does get to the people who it might be most relevant for. I think then, if there are no further questions, my only task, having now lost Brittany, is to thank Luke for such an engaging and informative presentation. I think I came in with an idea of what impact was, and I'm not going to say I'm an expert, but I think I know a lot more than I did, and I have a lot more clarity. So thanks so much for your time and sharing your expertise, and to everybody for contributing to a really rich discussion on something that we're all trying to do but aren't really sure of how to get there. So hopefully you have a little bit more in terms of tools or routes through to impact now. So thanks very much, Luke, and thank you to all of you for attending. And I hope you all have a lovely morning. Thanks so much.
Yeah, thanks guys. Really appreciate it.